The side effects specifically that exercise has been shown to decrease are anxiety, depression, and cancer-related fatigue. That cancer-related fatigue one is a really, really important one because we also hear that's the biggest barrier to exercise. You know, this whole field of exercise oncology that we call it started back in the 80s, actually by a couple of nurses. Were the first to suggest that patients should exercise during cancer treatment. So that was at the time where, you know, we were encouraging our patients to rest during treatment, and they suspected that it may help with their treatment side effects. And that was really where the whole field of exercise oncology was born. It's not going to look the same every day what they're able to do, but that every day is a new day. So if yesterday they didn't feel up to it, tomorrow hopefully they'll feel better and they can try again.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS member Rachel Hirschey, Assistant Professor at the University of North Carolina at Chapel Hill School of Nursing, and Associate Member at Lineberger Comprehensive Cancer Center in Chapel Hill, and member of the North Carolina Triangle ONS chapter, to discuss why exercise improves mental health, how it can help patients during and after treatment, and how it can also help the healthcare team. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining me today, Rachel.
Yes, thanks for having me.
So this is an exciting topic, and I think for a lot of people, when you're not feeling great or you're tired or lots of other things, exercise is the last thing that you think about, and sometimes the last thing that you think might help you feel better. But let's talk about how it can definitely improve mental health. What can you tell us about physical activity and the impact on an individual's well-being?
Gosh, physical activity has so many benefits on our well-being. It helps us emotionally, physically, and mentally.
I think that's really good points that you're bringing out, and I'm excited to hear more about how exercise really can help improve mental health and patients' well-being. So, Rachel, I know that there are some specific recommendations that have been made about physical activity and patients who have a cancer diagnosis. Can you talk to us about what they are and their specific benefits to our patients?
Sure, yeah. The recommendations are, interestingly, they're the same for everybody, whether you're living beyond a cancer diagnosis or not. But specific to survivors of cancer, the recommendations have been created by the American College of Sports Medicine and the American Cancer Society. The original recommendations were put out back around 2010, and they were just updated. And what is recommended is that people strive to do at least 150 minutes per week of aerobic exercise. And the high range of that could go up to 300 minutes per week. But if we're thinking about the minimum, that means we want our patients doing about 5 days a week, 30 minutes each time. Or if we have really fit patients, they may do more intense, vigorous exercise for only 75 minutes per week. But we don't want to think only about aerobic exercise. We also want to think about strength training or resistance exercise, because that also has independent benefits for our patients. So In terms of resistance exercise, we want to encourage that they do some form of strength training at least twice per week. So that could be using exercise bands, or depending on what type of yoga, some type of, body weighted exercise or yoga class, or actually lifting some weights. And, we of course want to keep in mind that those are recommendations, those are guidelines. We'll always consider precautions that need to be taken for patients based on their clinical picture and based on, where they are in their treatment. Sometimes people can't achieve that full 150 minutes a week in 2 sessions of strength training. But that doesn't mean that every bit doesn't help, every bit doesn't count, and it helps patients eventually get to that point where they are achieving what's been recommended. And I guess that brings me to, why these specific recommendations? What do we know? So the field of exercise oncology, we've got 40 years of research, and what we have learned is that aerobic exercise and resistance training at those levels, there's very strong evidence that for our patients that decreases cancer-related fatigue, it decreases anxiety, it decreases depression, it improves physical function, it improves health-related quality of life, and it also improves lymphedema. And there's evidence for that both for aerobic and for resistance training. So it doesn't, necessarily matter what type of exercise our patients do. They can achieve those guidelines in such a wide range of ways. And two other benefits that I should mention, there's strong evidence that strength training increases bone health, and that aerobic exercise improves sleep for our patients.
Perfect. Can you talk a little bit about how, for patients who are either on current treatment or even after treatment that are dealing with treatment related side effects, how can exercise reduce those side effects or even, prevent functional decline?
Yeah, so I guess maybe let's start with thinking about patients, who are on treatment or closer to that time of diagnosis, because that's really where we as nurses have the potential to make the most impact on patient outcomes. So it's a extremely challenging time in life when patients are trying to juggle and deal with so much during treatment. But it's also a really, really powerful resource that we can give to our patients by encouraging them to do exercise during treatment. And it doesn't need to be a lot of exercise. Some amount of activity can help. It can help actually reduce the amount of fatigue that they experience during treatment. It can help their emotional well-being during treatment. And those things in turn can also potentially help people complete their treatments and get through them feeling better. So by starting during treatment, people often have less side effects. The side effects specifically that exercise has been shown to decrease are anxiety, depression, and cancer-related fatigue. That cancer-related fatigue one is a really, really important one because we also hear that's the biggest barrier to exercise. So if we start early and can encourage our patients to do some amount of activity, then we really stand to help them minimize any decline that they may have during treatment. And that helps them be in a better position when they're done with treatment to really be active throughout longer term survivorship and live a healthier life and have a multitude of better health outcomes.
That's really good to know. And with patients right at initial diagnosis, some of the things that you mentioned, anxiety and depression, those are so prevalent with patients, getting that first diagnosis of cancer. And so, really trying to help them overcome those side effects or those mental health issues really are going to improve so many things during that whole treatment journey and the way they deal with and look at what the potential outcomes of their treatment could be. So, if we're talking about a patient who, is right at that beginning stage or maybe even one who has had a relapse. And so, that's sometimes where we see patients having or struggling with depression. How might a patient stay active? And how can we encourage them to stay active during these times?
Oh, I'm so happy that you asked me about this because this is something I think about a lot. It's often when patients may benefit the most from our encouragement to exercise, that it is the hardest to encourage them to exercise. So, what I see with longer term survivors and what I hear people say is they wish that they knew this earlier. They wish somebody told them this earlier. They wish that they knew to be more active during treatment. And what I also hear often from nurses who are taking care of patients during treatment is that there are other priorities, and it's not the patient's not asking about it, it's not their priority, and there are just very realistic competing clinical and emotional demands and physical demands that we need to attend to. But what I've also learned is that this can be a great way to empower patients. After a diagnosis, there can be a feeling of helplessness or loss of control that patients experience. And we really have the potential to provide physical activity recommendations to empower them, something that they can do to help themselves. And I think that when we do that, it's really important that we think broadly about physical activity. So it could, I think, seem very insensitive to suggest a spin class or some large amount of intense exercise. But physical activity, it can be just getting up and moving. It can be walking to the mailbox. It can be sitting out at the playground with your grandchildren or your children and trying to get up and move a little. It can be just trying to take more steps today than you did yesterday. So I think that if we meet people where they are and think broadly about what physical activity is, then there's a real opportunity there to actually use it as treatment for some of the negative things that patients are experiencing.
So, you mentioned a few things that might be barriers or that patients might struggle with in deciding to either stay physically active, or for some patients, they may not have ever been physically active. And so this is almost a new concept that, we're encouraging them to now do this in addition to, all the things that they're now dealing with their diagnosis and treatment. But what are some other factors that might be barriers or that you've seen the patients struggle with in actually participating in physical activity?
Yeah, I think about patient barriers to physical activity. I think about them in kind of three ways. So, one, we have kind of the physical, physiological, realistic barriers. And there are certain ways to overcome those. So we may need to consider certain precautions for some patients, given their physical condition and their health. Then there's also kind of the motivational barriers. And those I think are the easiest to think about because I think most people have experienced those, right? You know that you should go for a walk or you should go to that yoga class, but you don't really feel like it. So we can work with patients on motivational strategies and overcoming that. And then the final way that I think about it, and something that's really important, is also the more external barriers. So the practicalities of people having access to programs, people having a safe space that they can do exercise, and people having the resources and the knowledge that they need to know what to do.
So, what are some recommendations that a nurse might make to a patient who's having difficulty exercising or just keeping a routine?
Well, I think it's going to be largely dependent on the reasons that they may be having a hard time. So, if the motivation is there and there are not significant, medical concerns or barriers, then it might be connecting patients with resources and suggestions for exercise. Or it might be just helping them to figure out what's going to work best for them. So, what we know helps people most with exercise is having routines, something that's consistent, putting cues into your day that it's part of what you do, part of your identity, part of what your day looks like. So that could be as simple as encouraging a patient to keep a yoga mat on the floor so that when they, see that, it prompts them to do some stretches or to sit down and do some floor exercises for a few minutes. In terms of routine, it can also be helpful to ask patients about, what does their typical day look like? So if they have a goal to go for a walk every morning and consistently that's not happening, then maybe the morning's just not the best time. Maybe they feel really tired in the morning and it takes a while to, get up and get going. Maybe it's that, after an afternoon snack or when the sun is shining bright, that's when they feel better. So help them think through what their typical day looks like and what's the most realistic time that they would enjoy doing their exercise. So I think those are some of the kind of, realistic ways that we can help people fit it into their day. I also mentioned some people may have some medical barriers, medical concerns, or additional considerations where we need to take precautions with our patients. So as a nurse, the things that you want to be thinking about are, looking at patient labs if they're under treatment. Are you concerned for infection? Are you concerned for bleeding risks? And that doesn't mean that patients can't be physically active. It just means that we want to think about what we are suggesting they're doing. So if somebody's at risk for bleeding, you want to think about the kinds of activities that they're engaging in. You want to, keep it to things where they're not likely to be bumped and bruised and get injured. Things like that. We also see a lot of patients who have neuropathies or balance issues. So in those cases, we want to think about, maybe recommending more stationary type activities. So, riding a bicycle, for example, may be dangerous. So just thinking through, what type of exercise may be safe and which may not. Other things to consider is if they recently had surgery. Sometimes at the time close to surgery, depending on, what kind of surgery it was, let's say an abdominal surgery, for example, we wouldn't want patients straining a lot. So we would encourage them to stay away from weightlifting and strength training until their wound heals. We also want to think maybe about skin irritation and water. So swimming may be out for people going through radiation. So there's always going to be something that people can do, but we just have to think about, what is their physical health and what's going to work well for them right now and what's not.
That's a lot of really good information and a lot of good ideas for nurses in that direct care role to think about and start thinking about with the patients that they have. Are there any specific patient populations that maybe we have to look at or offer these recommendations in a different way too, whether that's younger or our older adult population or just special populations that we might be dealing with?
Yeah, I think when we think about patients of different ages and different types of diagnoses, there's a commonality across all of our patients. We want them all to do physical activity. The amount is actually the same recommended, regardless of age, regardless of type of cancer. We want to encourage, or, what is recommended is a minimum of 150 minutes per week of moderate intensity activity and resistance training 2 times per week. So, what that may look like, that may be 5 30-minute walks and, 2 yoga sessions. That could also look like, 5 hard runs and a strength training class and lifting weights another day. So the activity itself can be very different. And that's where we really want to consider what people are going to enjoy and what they're going to be able to do based on disease characteristics, based on preferences, and based on other personal characteristics and preferences. So we want to reach all of our patients and we want to recommend, we want to really focus on it for everyone. It's just that we want to think in very, patient-centered, person-centered approach in terms of how or what we recommend they actually do, or what we suggest to them that they consider for their activity.
That's good to know because I think that, when we do have patients across the ages, knowing that the recommendations for the amount of time, the intensity doesn't change, it just, like you mentioned, what they enjoy, talking to them and trying to find out what will work best for our patients that we have. You also mentioned earlier looking at labs and things like that. Are there any other types of things that nurses should look at in a cautionary manner when they're working with their patients and teaching them about exercise and physical activity?
Yeah, so the most important things, I think, when we're considering safety and potential precautions for patients with cancer, you mentioned the labs. So we want to, consider infection, consider bleeding risk. We want to think about if people have had surgery, any surgical wound healing that's going on. In addition to considering labs, we can consider if our patients have any catheters, feeding tubes, IVs, physical things like that may impact what kind of activity they can do. We also want to make sure that they're properly hydrated. So think about patient hydration. And finally, timing is the other big consideration. So, what I have seen a lot, and I actually had a great opportunity to be one of my friend's exercise partners through her treatment for colon cancer. And we really had to work on the timing. And I think this is relevant and important for so many patients that are going through treatment. It's not uncommon for even the most active of patients through treatment to have a window right after an infusion, usually 2 or 3 days for a lot of people where they have to back off a little. They're not able to do so much. And that's okay. That's often what's best and appropriate for the patient. So we want to think about that when we're counseling them for physical activity, that they expect that they know that might be part of the journey, that it's not going to look the same every day what they're able to do, but that every day is a new day. So if yesterday they didn't feel up to it, tomorrow hopefully they'll feel better and they can try again. And they can start just a little bit of activity. It doesn't need to be a half an hour every day. If 5 minutes is all that somebody feels up to one day, then 5 minutes was great.
So you talked about, how we can guide our patients and make recommendations. As those direct care nurses are taking care of their patients, and there are so many things that they have to consider and remember, and maybe how many patients that they're taking care of that day. And so adding this into the education that they're giving to their patients might seem a little bit overwhelming to people. So I'm just trying to kind of get an idea and help our listeners on how they can also get help to guide their patients in incorporating physical activity into their routine.
Yeah, this is so, so important. So, we're going on 4 decades now of knowing that exercise benefits our patients. This whole field of exercise oncology that we call it started back in the 80s, actually by a couple of nurses were the first to suggest that patients should exercise during cancer treatment. So that was at the time where, we were encouraging our patients to rest during treatment, and they suspected that it may help with their treatment side effects. And that was really where the whole field of exercise oncology was born, where we discovered the benefits of exercise on decreasing nausea among breast cancer patients. So this whole field, this is nursing, this is within our scope of practice. This is a very, very impactful way that we can help our patients. But we have so many competing demands, and it certainly can realistically be hard to integrate physical activity counseling into patient care. So I think about 3 ways that we can do this better, or 3 strategies for our field to do better. The first is, knowing your resources. So Oncology Nursing Society had their campaign Get Up and Get Moving, so we can look to that. We can also look to the American College of Sports Medicine just put out Moving Through Cancer as a component of their Exercises Medicine initiative, and there are great resources there. They're resources designed specifically for clinicians. There are patient handouts. You can look up online to find cancer specific physical activity support systems by geographic location. So you can learn, given where you are geographically in your town or city where you're taking care of patients, learn what resources are there and, put those together, have those handy for your patients. The other thing I think we can do is as we become familiar with the recommendations and we know what we want to encourage our patients to do, think about, how you can integrate it into the other parts of patient care. So if your patient brings up fatigue, if that's their biggest concern today, then physical activity or exercise can be part of that conversation. If they're not sleeping, well, there you go. There's another benefit of physical activity. There's another treatment to help with that. If they're worried about lymphedema, there was a time when we were worried that exercise increased lymphedema. We know that that's not true now. So exercise can help with that too. If they're experiencing a lot of anxiety. So if we can integrate physical activity as one of the treatment options for patients with many of the other conversations that are ongoing and not think of it as its own separate thing, but rather, part of the toolkit that we're using. I think finally, we need to really partner between the clinicians at the bedside and the nurse scientists who are doing research. So we've been doing research in the field of exercise oncology for 40 years now. It's really still, it's that bench to bedside lag. We know it's good, but the actual realistic practicalities of getting it to patients remains a challenge. So we need to partner. We need clinician and nurse scientist partners to design interventions that work, that we can also integrate into practice. So just knowing that an exercise intervention is going to help our patients does not matter if we're not going to be able to actually deliver it, if it's not conducive to delivery as part of nursing care.
That's so exciting and great to hear you talk about how this was something that nurses recognized, and nurses were the ones who really got the ball rolling on how exercise and physical activity can help our patients. And just another way that, we have been able to show, just how in tune we are with our patients and, that relationship that we build with them and understanding what is going to help them out. And we've talked so much about all the different benefits of this during, our discussion today. And, exercise is important for everyone, not just our patients, but nurses too. And, the studies have shown that cardiovascular exercise can definitely increase our well being and decrease physiological distress, emotional exhaustion, and, some of those things that nurses right now are really experiencing. So, what are some ways that nurses themselves can stay active?
I think the most important thing is to do something that you enjoy. So pick an activity, pick a few activities that you really like doing and focus on trying to do those. The next thing, figure out how you can make it a routine. So find the time of day or the days of the week that works best for you. Does it work best on the days that you work or the days that you don't work? Maybe, if you're working a 12-hour shift, then that's not a good day to do anything, and that's okay. So then think about what your routine might look like on your day off. Another thing that can be really helpful are, we call these in behavioral psychology, we call these contextual cues. So whether it be, putting your exercise clothes out the night before so that you wake up and you put those exercise clothes on, and that's, one step closer to getting your workout in. Think about if you have home exercise equipment that you use, whether it just be hand weights or maybe a yoga mat, or maybe you actually have a bike or a treadmill or something. Think about where that's located in your home and if it's set and ready to go and ready to be used. So sometimes those small structural and environmental things can actually really help us get our exercise done. And then I think the final thing is make it social. So, replace happy hour or coffee dates with hikes and walks with friends, and make this something that you do together and that you really integrate as part of your social circle.
Rachel, I just want to thank you for all of the information and tips that you've given us today. I think these are, as you mentioned, very valuable things that we as nurses can do for our patients and can help our patients start to incorporate into their routines and show them that they have the ability to make a difference in how they feel on their mental health and how this can definitely help their treatment journey for someone who has been diagnosed with cancer, as well as the nurses in this stressful time in the healthcare environment, and just how reminding them that taking that time to go out and take that walk or get together with a friend and go hiking is so important and will do so much for their own personal mental health and well-being. So I want to thank you for all of those things. And we're getting to the end of the podcast, and there are just some questions that I like to end every podcast on. And we're going to just go through these questions in a real quick fire manner. And the first one I'd like to ask you is, what are some common misconceptions about exercise's effects on mental health and well-being?
I think the biggest one is that we're going to burden our patients if we suggest that they exercise. This is really a gift. This is something that we can do to empower our patients and help them. So, the earlier, the better, the more often, the better. It's not a burden or a request for them to do something unrealistic, but it's more of a way of empowering them and giving them additional treatment options.
Great. The next question. What's something about exercise's effect on well being that's not often discussed, but you wish people knew more about?
Generally speaking, it's an easy sell. People think exercise is good and that it's going to improve your health. So that's not hard. But what I think we could expand is how we define exercise or think about it. So, just being active, every bit counts. Every little bit matters. And, even if it's a 5-minute stretch or a 10-minute walk, it can add up and it can really have an impact on your well-being.
Next question. What additional training or education do oncology nurses need to help patients increase their physical activity level?
We want to remember this is within our scope of practice. ONS has resources for us. So look at the Get Up and Get Moving campaign. And the American College of Sports Medicine. They've held 2 roundtables with the American Cancer Society. First one was in 2010. The last one, the publications came out in 2019. And if you look on their website, look up Exercises Medicine, Moving Through Cancer, really fantastic resources there, informational resources, practical resources of programs that you can find near you, resources for patients. And if you're really interested in it, the ACSM even offers a certification in cancer that you can learn all there is to know about exercise for our patients.
So, Rachel, thank you so much for being with me today and talking about how physical activity can improve our patients' health as well as the nurses and our listeners that joined us for this podcast. And we really appreciate all your information and knowledge and recommendations for us.
Yes, I was really happy to be here. So thank you so much.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.